At the time this video was researched, interviews were conducted with government departments, community groups, hospitals and medical authorities, members of the general public, and many other organisations connected with the problem of AIDS. Now, we set out to produce answers to the 200 most asked questions by the public. Some of these questions may seem silly and frivolous, but to many people, they're serious and need answering. The opinions compiled by our researchers have in many cases been conflicting. Therefore, the facts and fallacies presented are a consensus of all those professional opinions encountered by our researchers. It's our intention to take away the fears by exposing the fallacies and to make people responsible not only to themselves, but to others by stating the facts. This program is non-sensational. Some sections are necessarily explicit in their descriptions of certain personal habits and may offend. Therefore, parental guidance is recommended.
In early 1987, the Centre of Disease Control in Atlanta, USA, predicted that more than 1 million Americans were thought to be infected with the virus, and more than 90% of them did not know it.
Is AIDS a homosexual disease?
Can I get it from sharing lollies?
While public health officials first believed that perhaps 10% of those infected would go on to develop AIDS, evidence now suggests that at least 50% of them will progress to the full-blown disease. As more cases are reported, researchers have come to realize that the chances of developing AIDS are greater in the second 5 years after infection than in the first 5.
Does everybody that get AIDS die?
How did it get here?
Around the United States, health officials are calling for enormous increases in AIDS testing for pregnant women and even for couples applying for marriage licenses.
Why is intercourse linked with the transmission of AIDS?
I heard that a man with AIDS works in the kitchen of our local restaurant. Should I eat there?
AZT, a drug just now coming into use in the treatment of AIDS-infected people, is the most expensive prescription substance ever invented. It costs $14,000 per patient per year.
What's a condom?
What are high-risk activities?
In January 1987, it was estimated that the number of people with HIV in Australia was 50,000, and of those, 750 were children.
Whose fault is AIDS?
Can I tell if someone has AIDS?
The estimates of the proportion of patients who are diagnosed as antibody positive who will progress to full-blown AIDS have continued to rise. At first, it was as low as 10%. It is now 65% and still rising. Ultimately, many researchers predict it will be 100%.
Can I get it from a breathalyzer bag? If I work with a homosexual, what can I do to avoid catching AIDS?
In France, nearly 25% of adults who now have AIDS are neither gay nor drug addicted.
Daddy, can I get AIDS from mosquito bites?
Can HIV be transmitted through an air conditioner?
Nairobi. AIDS has infected up to a quarter of the population of some cities in Central and Eastern Africa, where it is now regarded as an unprecedented catastrophe. Since the epidemic started in Africa in the late 1970s and early 1980s, men and women had contracted the disease in equal numbers.
Should I fire the homosexual staff in my company?
What are the first symptoms of AIDS?
Grandma, does kissing give me AIDS?
Billions of dollars are being spent in trying to make people aware that a deadly disease called AIDS is upon us. But what is upon us? What does it all mean? How do we avoid it? Can we avoid it? The answers we hear are so conflicting, I'm sure most of you feel totally confused. The purpose of this video is to clear up many misconceptions, to take away the sensationalism, and to look at the hard facts, and to expose the fallacies. In this program, we'll take a look at the fallacies as they affect our children, teenagers, young single adults, married couples, people in the workplace, professionals, and the way it affects all of us in one way or another. AIDS stands for Acquired Immune Deficiency Syndrome.
I don't understand.
We're told that an AIDS-infected person is defined as someone who has a reliably diagnosed disease that is at least moderately indicative of an underlying case of cellular immune deficiency, but who at the same time has no known underlying cause of cellular immune deficiency, nor any case of reduced resistance reported to be associated with particular diseases. Do you understand that?
No.
Okay, now I'll tell you in plain English. Our bodies have a natural defense system to fight off any diseases, from colds right through to cancer. AIDS is a condition where the defense system has been destroyed and can't fight anymore, leaving our bodies exposed to any and all types of diseases. This defense system is called the immune system, and that's where the name comes from, immune deficiency, acquired immune deficiency syndrome, AIDS.
So, how do I catch AIDS?
You don't catch AIDS, you catch the virus that causes AIDS.
I'm confused. What's the virus?
This is the virus, the real enemy. It's called a lot of mostly unpronounceable names, but thankfully the medical world has got together and decided to call it by one simple name, HIV, Human Immunodeficiency Virus.
I still don't know what it is or how you catch it.
Don't worry, I'll explain everything in simple terms. You see, inside our bodies, as we've already mentioned, is a defense system. This is made up of an army of cells which we'll call soldiers. These soldiers are commanded by a lot of other cells that we'll call generals. This army, guided by the general, is geared to fight germs that enter from outside our bodies. For instance, if Johnny cuts his knee, the general gives a description of the enemy's germs to the soldiers. They then rush to the knee and fight off any germs that might be entering the body. As we know, the scientific name for this army which protects our body is the immune system. Let's look at a simple example of how the army fights to keep your body healthy. Take measles, for instance. To ward off an attack, we can now be vaccinated with a serum that tells the army what the potential enemy, measles, will look like. It gives a description of the measles virus. If the virus enters the body, the army immediately recognizes it and prevents the germ from spreading. So the trick is identifying the enemy. If the army can identify the enemy, it'll find and destroy it. This is where we get to HIV. Now, do you remember what HIV is?
It's the enemy, the virus that causes AIDS.
Right. HIV has a clever camouflage system which makes it almost impossible for the soldiers to recognize it and destroy it. I'll show you. Here's a normal, healthy white blood cell, which we've called the general. And these are the antibodies, which we've called soldiers. There are many generals and many, many more soldiers. One day, the HIV, the enemy, may enter your body. How it enters your body is something we'll talk about later. Once in your body, the HIV slips inside one of your generals, the white blood cells, remember, before the soldiers, the antibodies, have a chance to recognize and destroy it. Once inside the general, the virus breaks down and becomes incorporated as part of the general. This is known as stage 1. You are now antibody positive. Whether or not you go to the secondary and more dangerous stage is not definite at this stage.
Do I show any symptoms? Or am I sick now that I'm a carrier at stage 1?
No, to all intents and purposes, you're a normally healthy person. Except at this point, although you show no symptoms of sickness, you can transmit the HIV to others, which means you are dangerous. You are now what they call a carrier. From now on, if you don't practice safe sex and take precautions, you'll be putting others at risk. But back to our general. The HIV, which is now a part of him, is lying quietly inside doing nothing. By this time, the soldiers have been notified of the virus, but because the virus is now part of the general, they do not recognize it. To them, the general looks normal, and the virus remains hidden from the puzzled soldiers. In some people, it may even stay like this for many, many years. In others, for reasons we don't as yet fully understand, it'll launch a secondary attack almost immediately. The HIV begins this attack by multiplying within the general cell. New viruses are created using raw materials taken from inside the general cell. The virus then bursts out, leaving the general mortally wounded. At this stage, the general can no longer direct his soldiers. There's no communication. The soldiers, our immune system, are totally useless. Meanwhile, the enemy moves on to hunt and attack other healthy generals. The soldiers, antibodies from our immune system, are now totally confused. They've been told what the HIV enemy looks like, but the enemy keeps changing its disguise.
How does the enemy change its disguise?
Well, let's say he enters the body wearing a red uniform. The soldiers are told to attack anyone wearing that colour uniform. As the soldiers recognise and attack the enemy, he sheds his uniform to a blue one underneath, and he's able to escape. And by continually shedding his coat of many colours, he confuses the soldiers and remains free to enter and attack other generals. Now, as the battle rages, more generals are wounded and killed, leaving the soldiers useless to help the body's immune system. All types of germs now have the opportunity to slip inside your body without fear of the soldiers attacking them. Now our body begins to suffer from the attacks of the new germs and viruses. This is called stage 2, known as ARC, AIDS-related condition. And depending on what germs attack us from outside, various symptoms will show, such as swollen glands, weight loss, night sweats, pains in the joint, fatigue, loss of sex drive, and many, many others.
Am I still a carrier at stage 2?
Once you get the virus, you'll always be a carrier. Now the virus remains safely disguised within the body, continually attacking and destroying the generals, while the damaged immune system struggles to fight the attacks from both the HIV and the outside viruses and germs. No one knows how long it takes for the HIV to destroy all the generals, which is why we can't predict how long it'll take the AIDS virus to win the war and leave the body totally without an immune system. This is stage 3. This is what is commonly known as AIDS. Now the body can no longer fight any viruses or germs. The symptoms begin to show. Diseases such as cancer, lung disease, skin tumours and severe diarrhea, they all take hold. At this stage, there's no cure, and people who reach this stage are certain to die. Opinions vary greatly as to the likelihood of the stage 1 HIV carriers proceeding on to stages 2 and 3. For instance, some authorities believe that 60 to 70% of HIV carriers will show some symptoms after a period of, say, 3 years. 50% will develop ARC, the secondary stage, and over 75% of these ARC sufferers will go on to develop full-blown AIDS itself, the third and final stage. These percentages are increasing dramatically with time. Opinions also vary as to the length of time between these 3 stages. We've heard everything from 6 months to 20 years, but at this time nobody really knows.
That's frightening.
Oh, it certainly is. In addition to the battle we've just described, there's also a completely separate war waged by the enemy HIV. Once inside the body, it can also directly attack the brain. In fact, 60% of HIV carriers are attacked in this manner. It's not known how the enemy gets into the brain or how it destroys brain tissue. However, some people suffer brain damage before they even show any of the symptoms associated with the other battle involving the immune system.
So people die from diseases that occur because of HIV. The virus that destroys our immune system damages our brain and causes AIDS.
That's right. The condition AIDS is caused by the virus HIV.
I see now why you call HIV the real enemy.
Exactly. No matter what conflicting statistics we hear, one thing is for sure. The only way we can be certain of not developing AIDS is by not allowing the virus to enter our bodies in the very first place.
How do I know it hasn't entered already?
Quite simply, go to your local doctor or hospital or AIDS clinic and have a test.
What's the test?
It's easy. A sample of your blood is taken and examined. And if you have the HIV antibodies, you're notified immediately.
If I'm found to be an HIV carrier, Who do the authorities notify other than me?
Under the Public Health Act, the Health Department must be notified of all HIV-infected people, but the information given to them is not only confidential, it's also restricted to the first 2 letters of the patient's surname, plus their date of birth and sex. That means that nobody, except your doctor, will know who you are. Not even your family are told.
So we all should get tested?
No, not necessarily. If you're not one of those people whose lifestyle puts you at risk, you should have no need to worry. But if you are in the high-risk lifestyle, by all means have a test.
If I'm positive, I could be spreading the virus and not know it.
Exactly. On the other hand, you might be worrying about a problem that doesn't even exist. The point is, for your own sake and for that of others, if your lifestyle puts you at risk, have the test.
That gets us back to the original question. How do I know what's safe and what's not?
Well, that's what we're going to be concentrating on for the rest of this program. How the enemy enters your body and what you can do to stop it. There are 3 ways: through blood, through sex, and from a pregnant mother to a child. Let's start with sex. We've already established that an HIV carrier at stage 1 of the process can pass on the virus even though they show no symptoms of sickness whatsoever.
How do they pass it on to others?
Well, through certain body fluids, semen, blood, and vaginal secretions.
So it's not only dangerous for homosexuals.
Oh no, it can be transmitted from a man to a man to a woman to a man, or from a woman to a woman, between anyone who exchanges these body fluids.
How are the fluids exchanged in sex?
Mainly through anal sex, but also through oral and vaginal sex.
Well, I basically know what you're talking about.
Anal sex is when a penis is inserted into an anus. Vaginal sex is when a penis is inserted into a vagina, and oral sex is when the mouth comes into contact with the anus, the penis, or the vagina.
Does that mean we should stop having sex completely?
Oh, no, but you should start practicing safe sex. That's something I'll describe a little later.
Getting back to the dangerous body fluids, what about urine, saliva, teardrops, sweat and mucus? Are they dangerous?
Well, HIV can exist in each of these fluids, but in tiny proportions. They're only dangerous if they mix with the other serious body fluids already mentioned. That's semen, vaginal secretions, or blood.
Menstrual blood as well?
Yes. Any blood of an HIV-infected person is extremely contaminated, and blood can be passed in a lot of other ways other than sex. This is why we have made it a second category.
What are the other ways?
Well, the most obvious is a blood transfusion, although nowadays the chances of a hospital using contaminated blood would be very rare indeed. Blood banks now test all their supplies to ensure that they're not HIV infected. Unfortunately, some countries are still without the resources to ensure safe blood supplies. Oh, I should also mention here that there are no risks of contracting the virus from donating blood. Remember that.
How else can you get it?
The most common way HIV is spread is amongst carriers who use needles to inject themselves. Then they share the needles with others. Run a very high risk of contracting the virus this way. This situation arises very often amongst drug users who inject drugs such as heroin. A small portion of the blood remains inside the needle as it's withdrawn and is injected into the next user.
What about needles used by doctors and nurses?
A doctor or a nurse uses a new sterilized needle for each patient. The needle is then discarded.
What if I'm bleeding from a cut and my blood comes into contact with the blood from an HIV carrier? Am I at risk?
Yes, you are. Whenever contaminated blood is mixed with your own blood or your other body fluids, you are at risk. This can occur when infected blood splashes into the eyes or enters through a cut or abrasion on the body, including the inside of the mouth. Covers your skin sufficiently long enough to be absorbed by Langham cells. They're the cells found all over your skin, which possess the ability to absorb outside elements and direct them into the bloodstream. Up your nose. And as previously mentioned, infected menstrual or normal blood can mix with your other body fluids during sex. The third category is from mother to child. An infected woman can pass the virus onto a child during pregnancy, at birth when there's the excessive bleeding, or possibly via her breast milk.
That's a lot to keep in mind.
It certainly is, but you have to keep it in mind. In fact, I'd say there was a fourth category called ignorance. If you don't pay attention to categories 1, 2 and 3, if you don't read literature on AIDS, in short, if you don't care, you're putting yourself and others at risk. That is ignorance. Because AIDS is not a problem of particular groups such as drug users and homosexuals, it's a problem of lifestyles.
What do we mean by lifestyle and activities?
If a married man has extramarital sex with an AIDS carrier, he can become infected and infect his wife. If a young man has sex with a young woman who's previously had sex with an AIDS carrier, that young man may also become infected. If a married couple have anal sex and one person is infected, that person can pass the virus on to their partner. If a homosexual couple have sex continuously but practice safe sex, even if one is an AIDS carrier, the virus will not be transmitted to the other. So you see, AIDS is a problem connected with lifestyle, the way we live, and is not restricted to particular groups such as homosexuals.
Just before we go into the question and answer section of this program, I'm sure there are a lot of young people who would like to know what a condom is.
Well, this may seem strange, but I'll explain that a condom fits over the penis, providing a sheath which keeps the body fluids separated during sex. Condoms are sold at chemists, and they'll soon be available in many different types of stores, maybe even your supermarket. And now let's answer some of the 200 most asked questions.
Is AIDS a homosexual disease?
No, AIDS is the third and so far fatal stage of a total breakdown of the body's immune system caused by the HIV.
What is casual transmission?
Casual transmission describes those activities that we engage in our everyday environment where the disease may be transmitted.
What should I tell my husband if I found that I was HIV positive?
Tell him you've had a test and what the test showed. Your husband should then be tested. Be honest and compassionate with each other. If one of you is HIV infected, start practicing safe sex to ensure the safety of your partner.
Whose job is it to educate the public about AIDS?
Everybody's. Doctors, government departments, media, religious groups, family, and you.
Fact: there are many innocent victims of AIDS. Babies born of an AIDS carrier mother, someone who's been lied to before having sex with an HIV carrier, or someone who's been sexually assaulted by an AIDS carrier. These are just a few.
Can you get AIDS from using the same razor or toothbrush from an infected person?
Oh, that's highly unlikely. However, if sharing an instrument with an AIDS-infected person, be careful in avoiding blood-to-blood contact.
What are high-risk activities?
Well, anal and vaginal sex with an infected person, letting your mouth come into contact with semen or vaginal secretions, sharing contaminated needles, or sex toys where blood or body fluids are transferred.
Fallacy: AIDS is an act of God against homosexuals.
What age do you think children start asking questions about AIDS?
Authorities have come across questions from children as young as 6. There's advertising on TV. They hear older family members talking. If you have children, talk to them before they are misinformed.
Can I get AIDS from donating blood?
No. In Australia, each donor is injected with a clean, sterilised needle. The needle is then discarded.
Should condoms be more easily available, such as in vending machines?
Yes, indeed they should. Safe sex won't kill. AIDS will.
Do heterosexuals have anal sex?
Yes, it's believed quite a lot of people practice anal sex for birth control or even for religious reasons.
Can I get AIDS using cutlery in a restaurant?
No.
Do married men have men friends?
Yes, many married men indulge in homosexual activities with other men. If they don't take precautions, these people risk getting the virus and taking it home to their wives. There are more heterosexuals than homosexuals involved in homosexual activities.
Fact: there are more bisexual men having sex with other men than there are homosexual men having sex with other men.
Can I tell if someone has AIDS?
Only if it's reached stage 3. AIDS victims would normally be very sick and in hospital.
Can I get AIDS from handling money?
No.
Are some people immune to the virus?
Yes, some people, even after constant sexual contact with HIV carriers, don't seem to become infected themselves. The reason for this is quite yet as unknown. At this stage, you could say they're just lucky, but you mightn't be.
What's a bisexual?
Someone who has heterosexual and homosexual tendencies.
Can I catch AIDS from a massage?
No, providing there's no exchange of body fluids.
Is a pregnant woman automatically tested for the virus?
No. In Australia, she must request the test.
Fact, the percentage of women who develop stage 3 AIDS from heterosexual contact has more than doubled in the past 5 years.
Can you get AIDS from a gay friend or co-worker?
No, not through casual contact, even touching.
Can I get it from a breathalyzer bag?
No. Police use clean, sterile mouthpieces for each person.
I heard that a man with AIDS works in the kitchen of our local restaurant. Should I eat there?
Yes, there's no evidence the virus can be transmitted through air, water, or objects that don't come into direct contact with your bloodstream or other body fluids.
Can I catch AIDS from a mosquito bite?
Surprisingly, no. There's no evidence to suggest blood-sucking insects spread AIDS. HIV appears to replicate in a narrow range of cells, and mosquitoes and other insects have not spread the disease in tropical Africa, where there's a lot of AIDS.
Can I get AIDS from washing up?
No.
If I touch a person with HIV, what precautions should I take?
No, you don't have to take any. Again, the only risk is the exchange of body fluids.
How contagious is AIDS?
Well, diseases like colds and measles are communicable because they can be spread by being close to someone, sharing cutlery, coughing and sneezing. But AIDS cannot be spread by normal, casual, social contact and therefore is not a communicable disease.
Fact, at St Stephen's Hospital in London, there are 150 hospital staff caring for 400 patients infected with HIV. When all the 150 staff were recently tested for infection themselves, none were found to be antibody positive.
How can I tell if somebody has HIV?
Well, the first stage you can't. There are no visible symptoms at all.
What is safe sex?
Safe sex is avoiding the exchange of body fluids. Kissing's fine. You shouldn't have oral sex, should not drink urine, should not share sex toys such as dildos, and you should always use a condom.
Fallacy. Scientists have discovered a drug to prevent the AIDS virus from attacking the immune system.
If I work with a homosexual, what can I do to avoid catching AIDS?
All homosexuals are not infected with the AIDS virus. If somebody you work with does have the virus, you can only catch it off them if you exchange blood or body fluids. And these are most commonly transferred through sex and sharing needles. You can't catch AIDS off an HIV-infected person by casual transmission.
Fallacy. AIDS is a disease that only attacks homosexuals.
What's a condom?
As previously mentioned, it acts as a sheath to prevent semen from entering the partner's body.
My son doesn't like condoms. How can I tell him to use them?
Well, look, you've got to explain to him the enormous risk involved in unsafe sex, and that if he doesn't want to run the risk of being infected, he should use a condom. It only takes one sexual encounter in which safe sex is not practiced to put him at risk.
Can somebody with AIDS work?
No. A person with full-blown AIDS, stage 3, is a very, very sick person and will be seeking constant medical attention for one or more diseases. These can include lung disease, skin tumours, several fungal infections of the esophagus, and severe diarrhoea. They may also be suffering from brain damage.
Are people who work with raw sewage at risk?
Well, raw sewage consists of body fluids which are known to contain the virus from infected people, but the virus does not live for a long time outside the body. Remember that. There has been no recorded cases to date of anybody contracting the virus from raw sewage.
Should I stop having sex?
No. Sex is part of a healthy, happy and fulfilling life. You have nothing to fear as long as you practice safe sex.
Can I get AIDS from somebody biting me?
If an AIDS-infected person does bite you, there will be an exchange of body fluids, making the transfer of the virus a possibility.
If an ex-heroin addict fathered a child, would the child have AIDS?
If the father is HIV infected, there is a possibility. Both the father and his child should be tested just in case.
Can I contact HIV from electrolysis?
The government set quite strict guidelines for people in this profession, and the chance of infection is most unlikely.
How did it get here?
The virus is believed to have been introduced into Australia as a result of people travelling overseas and having sexual contact with infected people.
Fact. Chinese health authorities are implementing new regulations to test any foreigners entering their country for AIDS.
Can I get AIDS from the water bucket and sponge at football?
No, providing there's no blood in the water or on the sponge.
Can you get AIDS from kissing?
No, unless the person you're kissing is HIV infected and bleeding inside the mouth.
Fallacy. Some people are 100% immune to the virus.
Can someone with HIV work effectively?
Yes, the HIV-infected person has no symptoms or effects to prevent them from carrying their normal workload.
Can you get AIDS from sharing a cigarette?
No.
Can I get AIDS from body perspiration?
No.
Am I at risk in experimenting with drugs?
We know that the AIDS virus is spread through sharing needles. All I can say is just don't share needles.
Can you get AIDS from stepping on a needle lying on the ground?
Yes, that's possible. If the needle's been very recently used by an HIV-infected person, you would definitely be at risk.
Can someone get AIDS from having sex the first time in their lives?
Yes, if they have unsafe sex with someone infected with HIV.
Can I get AIDS from being sneezed or coughed upon?
There's been no evidence of this. Although HIV has been found in saliva, it's not believed to be in sufficient quantities to make casual transmission like coughing or sneezing a problem.
Can I get it from an ear piercer or tattooist?
No, providing they use clean needles and the only blood is yours.
Where do you buy a condom?
At chemists, from vending machines and clinics, and there are many avenues becoming more available as this problem expands.
What is a homosexual?
A man who has sex with another man.
Fact. An HIV-infected man in the United States bit a second man and was charged for assault with a lethal weapon.
How could I tell if I have the virus?
Well, you can't tell. You'd only have slight flu, maybe, or glandular fever-like sickness for 2 or 3 weeks after infection. If you're tested at this stage with the antibody test, it's most likely nothing will show, as the virus can have an incubation period of up to 3 months. So you could be infectious and infecting people.
Fallacy. Some races are more susceptible to contracting AIDS than others.
Can I get AIDS from a toilet seat?
There's no evidence to suggest this.
Can my children get AIDS from football or wrestling?
No, unless they exchange body fluids with an infected child.
Whose fault is AIDS?
It's nobody's. It's a virus that's entered the human body. The virus is the enemy, not people.
Can I get AIDS from somebody spitting on me?
No, although spit is a body fluid, there would be an insufficient amount of virus in the spit to create any danger.
Can I get AIDS from hugging?
No.
Can I get AIDS from a coffee machine?
Nope.
Fact. The first cases of AIDS were reported in mid-1981 in San Francisco, Los Angeles and New York City. By mid-1986, some 5 years later, an estimated 5 to 10 million people worldwide were estimated to be infected with HIV.
Can I get AIDS from office paper that has been touched by someone who's got AIDS?
No.
Can I get AIDS from swimming pools?
No, and I'll tell you why. Chlorine is a strong disinfectant used in hospitals.
Can I get it from playing?
No.
Can I get it from fighting and bleeding?
Well, if blood from an infected person is transmitted through body fluids interchange, there is a possibility.
Can the AIDS virus be carried through an air conditioning system?
No. Some diseases can be, but not HIV. Legionnaire's disease is one disease which can be transmitted through air conditioning.
Fallacy. People who have had previous sexual diseases are more susceptible to the virus.
Should I fire the homosexual staff in my company?
As we've said, the risk of HIV infection does not depend on contact with any particular group. It depends on lifestyle. Just because someone is a homosexual doesn't mean that they are HIV infected. And as we've discovered, HIV can't be transmitted casually in the workplace anyway.
Is there any discrimination brought from the outbreak of this disease?
Yes, discrimination in all sections of society, from the schoolyard to the media to the workplace. Most discrimination has been brought against homosexuals, prostitutes, IV drug users, and non-AIDS virus carriers.
Are Asians less susceptible to becoming AIDS infected?
No, AIDS affects everybody. Although scientists say it is theoretically possible for some races of people to react differently to the virus because of their genes.
Can someone with HIV work effectively?
Yes, the HIV is only the first stage of infection.
Can I get it from using a laundromat?
No.
Fact. More than 1 million Americans are thought to be HIV infected, and more than 90% of them do not even know it.
Can you get AIDS from a gay friend or co-worker?
In situations where people live with AIDS-infected individuals, there have been no cases of the virus being transmitted as a result of normal, everyday contact.
Why is intercourse linked with the transmission of AIDS?
Well, you see, there are large quantities of HIV, the AIDS virus, in semen and vaginal fluids. The virus can travel from one person to another via these fluids, through the vagina, the anus, or the mouth.
Can you get AIDS from dental instruments?
Any qualified dentist uses sterilized instruments which would not provide a surface for the virus.
Is there a vaccine to prevent AIDS?
Despite constant research, there's still no vaccine for AIDS. Scientists now fear a vaccine would even be ineffective anyway, as the antibodies from the defense system in our bodies can't get to the virus to destroy it.
Fallacy. AIDS is a man-made disease.
How do I clear up contaminated blood?
I'd say use bleach and rubber gloves.
Is there any risk living near a hospital for AIDS patients?
No, as we mentioned previously, the virus can't be transmitted through the air or through casual contact.
Should people who have AIDS be banned from working in banks and restaurants and places like that?
No. A person with the AIDS virus is allowed in the workplace unless there is a risk of blood-to-blood contact with others. Remember now, the virus is not casually transmitted.
How do I dispose of needles I find lying in public places?
Be very cautious, as it may have been used by an HIV-infected person. Needles and syringes should be disposed of in rigid, puncture-resistant containers. More importantly, dispose of it so carefully so that you don't get pricked. Then wash your hands.
What are the safety procedures of healthcare workers?
Anyone whose occupation involves direct contact with body fluids should practice the following safety procedures. Take care when disposing of needles, guard against needle sticks, cuts and other injuries, wear protective clothing if there's any danger of splashing body fluids. They're the main ones.
Why are homosexuals considered a high-risk group?
Well, during anal intercourse, the virus can be transmitted via semen into the bloodstream.
How do women contract AIDS?
Well, research in the USA say that most women who have developed AIDS also use drugs and most probably have shared needles. However, there's also a growing number of women who've contracted the AIDS virus as a result of unsafe sex with an infected man.
Fallacy. During sexual encounters, the passive partner is the only one at risk.
How do children get AIDS?
Often from their infected mother, as a result of the child being maybe sexually abused by an HIV-infected person, or from a blood transfusion received before the Red Cross introduced the testing of donors for the virus.
Am I at risk in experimenting with sex?
Well, the AIDS virus can be transmitted during an exchange of blood, semen, or vaginal fluids.
Why are intravenous drug users a higher risk for AIDS?
Well, the chances of contracting the AIDS virus increase if they share those needles.
Is there a connection between prostitution and AIDS?
Professional sex workers are not responsible for AIDS. Most prostitutes insist on clients using condoms.
What has been done to minimise the risk of getting AIDS through blood transfusions?
All donors are screened and must declare that they're from a high-risk group. The blood is thoroughly tested to ensure blood containing any indication of AIDS infection is not used.
What are the first symptoms of AIDS?
Some symptoms are commonplace ailments. However, in the case of AIDS, they are more severe and extremely persistent. These symptoms may include extreme tiredness, sometimes combined with a headache, weight loss of more than 5 kilos, not due to dieting, persistent swollen glands in the neck or the armpits or groin, a heavy continual dry cough not related to smoking or common respiratory infection, thick whitish patches on the tongue or in the throat, that's called thrush, which may be accompanied by a sore throat, unexplained bleeding from any body opening or from the skin or mucous membranes, bruising more easily than usual, progressive shortness of breath, persistent cold sores. Just remember now, AIDS is the 3rd stage.
How long does the virus live in dry blood or outside the body?
Well, to be honest, we don't know exactly, although it's definitely only able to exist outside the body for a very short period.
Fact. AIDS has been reported in 102 of the 131 countries that report to the World Health Organization.
Can I get AIDS from sharing a cup with a crack in it?
No.
Is the virus contagious in its early stages?
Anyone with the virus is contagious from the moment it enters their body.
Can I have gay friends and not be at risk?
The virus is transferred during intimate sexual contact or exchange of body fluids. It is not transferred during casual acquaintance. It is safe to associate with homosexuals, but it is dangerous to practice unsafe sex with an AIDS sufferer.
Can I get AIDS from smoking a joint?
No, most unlikely. There's no record at this date of the virus being transmitted in this way.
Will I get AIDS from sharing a drink?
No.
Who's a safe partner?
Somebody who for the past 7 years has had no exchange of body fluids with anybody likely to be in the high-risk group.
Should young couples have tests for AIDS before having sex?
They should practice safe sex, as previously discussed. If they have any doubts about their partner's previous activities, a test is advisable.
Can I get AIDS from eating my friend's lunch?
No.
Why are homosexuals considered a high-risk group?
Well, because when AIDS was first detected, the majority of sufferers were found to be homosexuals. As the virus began to appear amongst heterosexuals and bisexuals, it was realized that the virus was not restricted to homosexuals alone.
Fallacy. Every homosexual will eventually have the AIDS virus.
How many children have caught AIDS?
Well, in Sydney on the 1st of July 1987, there were 5 children under the age of 10 suffering from AIDS. All had contracted the virus through blood transfusions.
What's the difference between being antibody positive and having AIDS?
The AIDS virus, HIV, causes the body to produce antibodies. Once the virus has reached stage 3, the body has a totally deficient immune system, and the person is said to have AIDS.
Is all sex dangerous?
No, sex is not dangerous unless it's with an HIV sufferer, and safe sex is not practiced.
Can I catch AIDS from a waiter?
No, somebody serving you food and beverages cannot give you AIDS.
Do people with AIDS suffer pain?
Yes, indeed. The onset of full-blown AIDS often means the sufferer can also contract many painful diseases. Some, however, can be relieved by medication.
Does everybody that get AIDS die?
Once the AIDS virus has reached stage 3 or full-blown AIDS, the condition is fatal. However, there are more people alive with AIDS than dead, and there's still hope that a cure will be discovered in time to prevent more people dying.
Are ambulance drivers at risk?
Well, they should be very aware of the need to practice the recommended safety procedures, as the chances of them coming into contact with HIV sufferers are quite high.
How safe is mouth-to-mouth resuscitation?
There is a risk involved in this life-saving procedure due to the almost inevitable exchange of body fluids, but it's just a risk. For all the facts and fallacies of AIDS, one thing is certain. There is no cure for AIDS at this stage, although scientists around the world are working around the clock in an effort to find one. All we can do is try and prevent the enemy, the AIDS virus, from entering our bodies in the first place. You've heard how it enters your body and what you can do to prevent it happening.
You've certainly given us a lot to think about.
When you're dealing with a matter of life and death, it's worth thinking about. If the information we've presented is too much for you to absorb in one viewing, I suggest you look at this program again. More importantly, look closely at your own lifestyle. Are you involved with any of the high-risk activities mentioned? Now remember, AIDS infection occurs as a result of particular lifestyles and activities which could be common to all of us, and infection can be prevented. If you're infected with the virus, be responsible. Practice safe sex and don't put others at risk. For the sake of not only this generation, but generations to come, let's all become a little more informed and take a lot more care to protect not only today's children, but the children of tomorrow, who come into this world depending on us to give them every chance of a happy and healthy future.